billion in capital investment anticipated. That means thousands and thousands of good-paying jobs. Alberta Treasury Branches this week has estimated that we will see the highest number of housing starts in Alberta in 7 years. The Calgary Real Estate Board said that there are very few homes available on the market in Calgary and that values are now going up significantly in this city. We saw new data showing that the number of Albertans receiving employment insurance benefits is down by 55% year over year. And of course, we closed out 2021 with the creation of over 130,000 net new jobs. So all great news. I think it's important to point that out, that Alberta has got real economic momentum. A key part of that, of course, is our huge exports, particularly to our largest trading partner, the United States. Alberta in 2020 exported $78 billion in goods and services to our largest trading partner. The year before, 2019, our exports were worth more than $100 billion, and we believe, pardon me, that with the increase in commodity prices, we'll be able to break that record again and sell the Americans over $100 billion worth of Alberta-produced goods and services. That export trade with the United States supports 785,000 jobs in Alberta's economy. And so there are very few issues more important for us than our trading relationship with the United States. But there are barriers being erected, barriers to pipelines. Of course, the veto of Keystone XL, but also the effort by the state of Michigan to decommission the Enbridge Line 5 project and many other political and legal battles being led to landlock Canadian energy and Alberta oil and gas from the United States. We also see growing American protectionism expressed in areas like, of course, softwood lumber, the Buy America provisions, and now we see serious emerging threats to our supply chains. As we know, much of our grocery stores are stocked by products produced in the United States. We are seeing huge inflation in the cost of food and many other basic necessities here in Alberta and across Canada. And that situation, that bad situation, has been made worse by the Trudeau government's reckless decision to impose a quarantine requirement on unvaccinated truckers coming from the United States, which has further stressed supply chains, and that will further create issues around availability of food, essential products, pushing up in prices at the worst possible time. Of course, the U.S. government has done the same thing for Canadian truckers traveling south. We don't think there's any compelling public health reason for this, given that there are millions of Canadians with active Omicron infections, tens of millions of Americans with active infections. The vast majority of truckers are vaccinated, and the government's had granted a multi-month exemption to this rule. We simply ask them to restore that exemption. I've been on the phone and in contact this week with governors and premiers on this issue. And indeed, a number of the governors signaled for me that they were gathering in Washington, D.C. this weekend for the National Governors Association annual meeting. I've decided at their prompting to travel to Washington. I'll be going straight there following this news conference to spend 3 days in Washington, D.C., attending the National Governors Association meeting, meeting with many of the top leaders and decision makers in the United States, amongst the governors, congressional leaders, as well as potentially people in the U.S. administration and important stakeholder organizations like the Teamsters, the U.S. Transport Association, the U.S. Chamber of Commerce, and other organizations. Stay tuned for more details, but this is a very important mission. First of all, to seek supporters for our effort to get the two federal governments to suspend the application of the quarantine requirement for truckers, to work more deeply on the many supply chain issues which are a serious threat to both economies, but also to continue our efforts to fight for market access and pipelines for Alberta energy exports to the United States, and to work on other important trade issues such as the Buy America provision and softwood lumber. Our relationship with the United States is so important that Alberta's government recently announced our plan to open 3 additional trade and investment offices to represent our vital economic interests in the United States. This trip this weekend is an important part of that. Another piece of good news before I get to the COVID update, and that is I'm very happy to see that the United Nurses of Alberta members have ratified a new collective bargaining agreement with the government of Alberta. I understand 87% of their members voting ratified the agreement. And let me just say how much all Albertans value and appreciate our nurses, particularly given the huge stress they've been working under over the past 2 COVID years. And we have tremendous professionals. Many of them have taken on extra shifts over and over and over again, and many of them are struggling with burnout because of the pressure that many of them have been experiencing, for example, in ICUs and now in emergency wards in many parts of the province. We value and appreciate Alberta nurses. I believe that this collective bargaining agreement is a win-win because it provides for modest compensation increases, but in line with our need to be fiscally responsible. I think it's a win for nurses and a win for taxpayers. It ensures that Alberta nurses continue to be the best compensated in Canada. At the same time, it brings their compensation closer to the national average and other provinces, which has always been one of our objectives, so that we can reallocate more of our growing healthcare budget to delivery and to address the historic misalignment with other provinces on labor costs. So this, I think, is a compromise on both sides to get to this point. I want to say thank you to the UNA for negotiating in good faith, and we're very happy that we could come to this agreement, which ensures continuity of service and stability amongst our critical workforce of nurses. The agreement also includes enhanced psychological and mental health support for nurses and a rural capacity investment fund to help incentivize nurses to work in rural communities that sometimes have challenges attracting and retaining health workers. So very good news there. Now, finally, let me speak to the COVID update, and Dr. Hinshaw will follow me. I'm pleased to report that we continue to see good news, but we continue to have reason for caution. We continue to see the positivity rate come down slowly, and certainly the total number of active cases. Our wastewater data is trending down in 14 of the 18 communities that we monitor. So that continues to be the same case as last week. And most importantly, we've seen significant declines in the trends in Calgary and Edmonton, where Omicron started first. ICU numbers for COVID have been trending down as well, a little bit. We have today 106 COVID patients in intensive care and 194 patients in intensive care overall, COVID and non-COVID. Worth noting that 28% of the 106 COVID patients in intensive care are incidental COVID cases. They tested positive, but they're not there because of COVID, and so that's context. Now, to compare this to the peak of the Delta wave last September, at the peak we had 257 COVID patients in ICU and 317 overall. So today, those numbers respectively are 106 and 194. So since we seem to be beginning to come down or destabilize on the ICU pressure, we're grateful to see that because of the lower severity of Omicron, a large part of which is because of higher vaccination rates, we have seen much less impact on our intensive care units. Now, in terms of non-intensive care, acute care beds, we currently have 1,363 COVID patients, or I should say patients with COVID in hospital. 40% of those are incidental. That is to say, they were not admitted to hospital because of COVID, but they've subsequently tested positive. So now that number has gone up over the past week or two. And there is real stress in the system. We see particular stress in some of the large urban emergency wards. But the good news in this context is that the overall burden of inpatients in our 100 hospitals across the province is stable. We've been averaging just under 5,300 total non-ICU inpatients since the beginning of January. Right now, we're at 5,369. And so we've had a stable overall patient population in the hospital system over the past month. And I should add that, in an historic context, what we're facing right now is not unusual. In 2018, in January, we peaked at 5,600 inpatients and that meant 99% of available beds were full. In 2019, we peaked at 5,400 inpatients and 96% of beds were full. And in 2020, pre-COVID, we peaked at 5,600 with 89% of beds being occupied. So right now we're at 5,369, representing 87% of beds. So there's 13% of beds available, inpatient beds. And now the stats I just cited are for the 16 largest hospitals in the province, and that represents by far the majority of inpatient beds. And the point is that there is significant stress. It is not out of line with historic trends at this time of year, although there is additional stress on the hospitals because of COVID protocols. And there is continued need for Albertans to be cautious, careful. Please continue to follow the public health guidelines and measures. And please, if you have not yet done so, get your booster shot. I understand that today Alberta Health Services did open the pandemic response unit in Edmonton. I described our preparation for this work last week. So this is a kind of overflow capacity for patients who are close to being released from hospital, but they may need some ongoing monitoring and some ongoing health support. We have not yet been in a position where we had to open the pandemic response unit in Calgary. And finally, on schools, out of the some 2,400 K-12 schools in Alberta, currently 25 have moved to online instruction. So that's about 1% of the over 2,400 schools in Alberta. Once again, thank you to students, most importantly, the teachers, parents, and everybody in the education system for their care and diligence during what has been a challenging time. I'm looking forward to taking questions afterwards, but now I'll invite Dr. Hinshaw for her remarks.
Thank you, Premier, and good afternoon, everyone. Before I get to the latest numbers, I want to clarify what the isolation requirements currently are in Alberta and when they begin, as I've heard some questions on this topic. If you have COVID, the greatest transmission risk is in the few days before and after symptoms start, but it is still possible for some people to transmit the virus and infect others for up to 10 days. That is why if you are not fully immunized, you must isolate at home and away from others for the full 10 days. If you share a home with others, you should isolate away from the rest of the household and at minimum should wear a well-fitting medical or 3-layer cloth mask if you were in the same room as others at any time. If you were fully immunized with 2 or 3 doses, you must isolate away from others for at least 5 days from the day you were first symptomatic or tested positive. That is considered day 0. On day 6 after the onset of symptoms, counting from that day 0, or the 6th day after a positive test result, if your symptoms have resolved, you're able to leave your home but must complete the rest of the 10 days of isolation by wearing at minimum a well-fitting medical or 3-layer cloth mask at all times. This means that in this time period, you are not able to remove your mask to eat or drink with or near others. This is important to mitigate the transmission risk in this second part of the 10-day period. After that full 10 days have passed, you no longer have any specific isolation or masking requirements over and above the public health measures in place. I also want to provide some clarity for Albertans who have recently tested positive for COVID-19 on when they might need to contact their family physician. This will help save time for those with COVID and reduce unnecessary calls to busy clinics. If you have a positive test result, you do not need to contact your family doctor with the results unless you are at high risk or experiencing moderate illness or symptoms. If you're not sure what level of risk you're at, the Alberta Medical Association has a reference document on their website that can help you assess this. If your risk is moderate to high, you should contact your doctor's office and advise them of your situation so they can help determine the best treatment path for you. If you are in this group and want to share your rapid test result with your physician, you can complete the form available on alberta.ca and submit that along with a photo of your rapid test to the clinic. This reporting is optional, but may be important or helpful to some individuals. I've also heard that some Albertans think they may need a doctor's note when they have COVID to be eligible for certain benefits or for sick time at work. However, in most cases, you do not need one. If you are applying for the Canada Recovery Sick Benefit or the Canada Recovering Caregiving Benefit, a note is not required as long as you meet the eligibility criteria. If you contracted COVID-19 in your workplace as a result of your regular job duties, you may be eligible for coverage and support through the WCB. They accept a positive PCR or rapid test result or a doctor's diagnosis as part of their claim process, so a doctor's note is not required if you have a positive test result. Due to the rampant spread of Omicron, we ask employers not to require individuals with mild symptoms to get a COVID-19 test or doctor's note to be eligible for sick time off work. Instead, please support sick employees at this time of high transmission to stay home with no testing or doctor's note requirements. Some patients have requested a doctor's letter to help facilitate some aspect of domestic or international travel. But doctor's notes are generally not required or warranted for travel purposes. It's most important that anyone planning to travel is fully vaccinated and has proof of their vaccines. I hope this information is helpful for those who might be wondering when to call their doctor about COVID. Turning to today's numbers. Over the last 24 hours, we have identified 3,218 new cases of COVID-19 and completed about 9,350 tests. Our positivity rate for lab-confirmed tests is about 34.7%. As you know, due to the rapid rise of the Omicron variant, we adjusted PCR testing eligibility a few weeks ago to ensure those who have clinical risk factors, for severe outcomes, and those who live or work in high-risk settings can get tested and receive their results in a timely manner. We continue to monitor this approach closely and evaluate the capacity of our labs. At this point, we are able to meet the demand for all these high-risk individuals in a timely way, and we have the opportunity today to introduce a small change to PCR testing eligibility. Effective immediately, children under the age of 2 are again able to get tested for COVID-19 through AHS assessment centres. This is a pragmatic approach since rapid tests are currently not licensed for use in children under the age of 2. The ability to be tested affects the length of their required isolation due to COVID, as these children are also not eligible for vaccination. If a child is symptomatic and tests positive for COVID-19, they are required to isolate for 10 days. If they are symptomatic but test negative, they can leave isolation once their symptoms resolve. Given this requirement and the link to test results, we want to ease the burden on parents by allowing them to access PCR testing again, since rapid testing at home is not recommended for this age group. Parents and guardians can book appointments online for children under 2 years with symptoms using the AHS assessment tool or by calling 811. For older children who have symptoms, rapid tests can be used, which is why the change today is only for those under age 2. Sadly, I must announce today that 14 new deaths have been reported to Alberta Health over the last 24 hours. As always, I extend my sympathies to their families and to all those grieving the loss of anyone they loved, no matter the cause. Between the post-holiday lull and the cold, dark days, January can be a difficult month. That was true in a typical year before we had to contend with COVID-19 and the Omicron variant. Combined with those factors, though, this January may feel more challenging than ever. As we near the 2-year milestone of the pandemic, I know people are experiencing a lot of complex emotions, and many Albertans are struggling. Whether it's from being infected with the virus, the stresses of upended routines, or struggling to see when we can return to a more normal way of life, many of us are having a difficult time. For many, practicing self-care strategies such as maintaining exercise, eating well, using relaxation techniques, or relying on loved ones is enough. However, if you or someone you know finds these struggles are overwhelming or interfering with your daily life, I urge you to seek mental health supports. Free, non-judgmental help is available for anyone who needs it. A list of comprehensive resources is available at alberta.ca/mental health. No matter what you are struggling with, I want you to know you are not alone. There are supports and resources out there for you, and many other people are going through similar challenges. In the fall, findings from a national survey were released that indicated 1 in 4 Canadians aged 18 and older screened positive for symptoms of depression, anxiety, or post-traumatic stress disorder in spring of 2021. This is up from 1 in 5 in the fall of 2020. These symptoms undermine an individual's well-being and quality of life. The good news is that there are mental health supports to help all of us through. As I've said before, we must remember that the enemy we are fighting is COVID-19, not each other. Now more than ever, it is essential to intentionally employ compassion, both for ourselves and those around us. We don't know the situations or challenges our neighbors are facing, but we can safely assume that things aren't easy. We need to make time to care for ourselves and those around us. Kind gestures can go a long way in helping each other. I ask all of us to create safe spaces for our own and others' emotions, given the burden of grief that so many are carrying. Each one of us matters, and our actions make a difference. Thank you, and we're happy to take questions.
Thank you, Dr. Hinshaw. That concludes the formal portion of today's media availability. We'll now move over to a Q&A. Since there are no journalists here in person, we'll move right over to the phones. Just a reminder to callers to limit yourself to 1 question, 1 follow-up, as well as try to keep your questions as brief as possible. With that, operator, can you please connect our first call?
Thank you. Matt Woodman, CTV.
Hi there, Dr. Hinshaw. The Premier explained that it was necessary to open the pandemic response unit in Edmonton. I was hoping you could explain why that was necessary and how many patients are currently staying there.
Unfortunately, I don't have the details of the acute care burdens or the shifts of patients in terms of where they're being cared for. What we do know is that the burden of disease that Omicron has caused is straining the capacity of the system, in particular in some urban areas, and that this is meaning that there are extra spaces that needed to be opened up. The specifics of how many patients and how that change and shift is happening, unfortunately, I don't have that information.
And I'll just add, I'm afraid I don't have the exact number of patients in there right now, but this is something that we've been preparing for a long time. We signaled last week that AHS was taking the next steps to prepare the pandemic response unit, should they be necessary, to add some additional overflow capacity. As I pointed out in my remarks, we are at 87% of our inpatient bed capacity through the entire 100 hospital network of Alberta Health Services, at 87%, we are at a lower percentage of capacity than is typically the case at this time of year. However, as Dr. Hinshaw just said, some of our large urban hospitals are under particular stress. That's where a lot of the patients end up getting transferred to. And so we're closer to 98, 99% capacity in some of the large urban hospitals. As you know, one of the challenges with COVID patients, whether they are hospitalized for or with COVID, whether they are primary or incidental in terms of COVID-19, is they all require additional space for isolation protocols. And that just takes up more space, more rooms in the hospital, more inpatient bed space. And so the PRUs are there to kind of accommodate for that factor of requiring a bit more space to spread people out, given isolation protocols within the hospitals. The PRUs, as I understand, have been briefed by AHS. Initially, 18 months ago, we were looking at these facilities potentially for overflow intensive care capacity, for ventilated beds and intensive care. That is not the need at this point. In fact, we're dealing sort of with the other end of the spectrum of severity. For hospitalized patients, these PRUs will largely be used for patients who are close to being released from hospital, but require some additional monitoring before that happens. So it's a strategy to create a little bit more space and flexibility within the system.
Okay, and Matt, do you have a follow-up today?
I do. We're hearing about high numbers of cases in some long-term care facilities. Is there anything new being done to protect residents from COVID spreading within these settings? And is there any additional supports for these centers?
I think Dr. Hinshaw.
Sure. So we've been working with stakeholders in the continuing care sector, meeting regularly with operators to understand the impacts. We know that in continuing care, the goal that we have had for many, many months now is to try to balance all of the health needs of those residents. We know that residents need the protection from COVID-19 infection. We also know that they need to have connections with people that they care about so that they're not feeling isolated. So visitor restrictions, we know when we put those in place previously, had a significant negative impact on mental health and well-being of people who lived in these settings. We also know that residents who live in these settings need to have people who can meet all of their care needs, and so making sure that there are enough staff in a time where there are lots of individuals who are falling sick and need to be off work. So we are working to try to balance all of those care needs for people in these settings. The good news is that so far we're seeing the hospitalization and severe outcome ratios of the cases in these settings as being much lower than we've seen in previous waves. However, we are working as hard as we can with those operators, with our partners, with Alberta Health Services, to make sure that supports are provided when cases are identified to minimize spread. Unfortunately, in some cases, we have seen larger outbreaks. But again, these are all the factors that we're trying to balance: the emotional supports, the connection with people that these residents care about, the COVID protections, and the care needs, and we will continue to do so.
Thanks very much, Dr. Hinshaw. Operator, can you please put through our next call?
Thank you. Rick Bell, Calgary Sun.
Good afternoon, Premier and Dr. Hinshaw. For the Premier, first question is, what do you say to those people, which, by the way, includes some of your MLAs and supporters, but people generally who, when they hear this evolving good news, would like to see an end to vaccine passports, not just as it relates to truckers, but just generally? Then they'd like to see that happen. Some of them want to see it happen now, but others want to see it happen at least in the very near future. And related to that, they see that as just the first step towards a fairly soon, maybe a month, 2 months, I have no idea, maybe St. Patrick's Day, lifting of restrictions generally. So the question is basically, there are people who want fairly soon the vaccine passports for everybody to be lifted, and then not, maybe weeks later or whatever. How do you see that picture shaping up from those numbers that you've given us?
Well, I'm one of the people that wants to see an end to the restriction exemption program, and as quickly as possible. But that's not right now, Rick. We are continuing to see upward movement in our inpatient bed hospitalization pressure from COVID-19. And we're at, in fact, the highest point in the 2 years in terms of people in hospital with COVID. So while there is some good news that can be encouraging for all of us, now is not the right time to be relaxing measures when the health hospitals are under so much pressure. But I very much hope that we can move towards widespread relaxation of public health measures, including the proof of vaccination program, in the foreseeable future, once we start to see the pressure on hospitals trend down. And we are going to make that decision based on data, based on what we're seeing in other jurisdictions that hit Omicron before Alberta. And of course, we'll take very seriously all of the public health advice that we receive. Rick, I would say I understand people's impatience. I share it. I did say when we brought in the proof of vaccination program back in early September that I did not foresee it going past the first quarter of 2022. That would be the end of March. And I am hopeful, based on the trends we're beginning to see here and we've seen elsewhere, that we'll be able to consider lifting that and most other public health measures well before that. So I'm not going to start guessing about when, it's too early to do so. I would just say to people who are impatient, I am too, I get it, but let's just, after a couple of years of this thing, just keep our eye on the ball, have the backs of the people in our hospitals. Let's not start removing measures that could trip us back into higher transmission and hospitalizations when the hospitals are already under so much pressure. So that day you're talking about is coming. I'm pretty confident it will come in before the end of March. And I hope it comes, and I'll just tell you this, we will eliminate the restriction exemption program as soon as it is safe to do so.
Okay, thank you, Premier. Rick, do you have a follow-up today?
Yes, I do. It's COVID related, and it's related to the convoy, the trucker convoy, which you've talked about before. Now, we all know what the stated purpose of the convoy is, so I'm not going to ask you what you've already expressed about your view of the convoy, but do you see this protest as also having a broader and deeper message to the federal government, to all Canadian politicians, and to other decision makers, that this sort of grassroots cross-country convoy is happening? Is there some message that you think political figures and other, perhaps non-elected decision makers, should take seriously from watching this?
Well, first, Rick, I think it's important to say that we should all be grateful for truckers. They keep our grocery store shelves stocked day in and day out. They have, while a lot of people were sheltering at home over much of the past 2 years, they were out there on the roads in good weather and bad, keeping us and our whole society and economy rolling. So thank you to the truckers. And I think it's important to acknowledge that. Secondly, Rick, everybody has the right for democratic and peaceful protest in our country, and we should be respectful of that. I agree with those who are protesting the, I think, pointless quarantine rule being applied to cross-border truckers. That's why I'm going to Washington, D.C. today to raise this with top American leaders. And I do hope that those organizing the convoy do everything they can to make sure that it's safe. I hope that they disassociate themselves with anybody in the convoy who might have extreme or hateful views. But I acknowledge that, in any big social movement, there are going to be some people with fringe views. Whenever the NDP shows up at some of those so-called environmental protests in the front of the legislature, there are people who hold what I would call eco-terrorist views. I don't see the media running all over their social media accounts trying to throw a spotlight on them. And I don't see the NDP disassociating themselves with everybody who might show up with extreme views at a protest. Now, Rick, one thing that really concerns me is the divisive comments of Justin Trudeau, where he said, he characterized all of the thousands of people involved in this as, he said we should not tolerate them. And he said that they are holding unacceptable views that don't represent the views of Canadians. Well, whether he agrees with them or not, they are Canadians, and they're entitled to hold their views about COVID policy, and they're entitled to express them safely and lawfully. This is the same Prime Minister who famously said about Canadian citizens convicted of terrorism that, quotes, a Canadian is a Canadian is a Canadian. Well, if he's willing to defend convicted terrorists as Canadians, why is he condemning thousands of people who feel strongly? I think the Prime Minister's job is to unite Canadians, not divide them. I think his divisive approach to this makes the situation a whole lot worse, as does his quarantine policy on cross-border truckers, which is forcing up food prices and making life even more difficult.
Thank you, Premier. Unfortunately, we are on a bit of a tight deadline today to get to the airport, so we might only have time for one more question. We'll try to squeeze another one in if we can, but with that, operator, please put through our next call.
Safe Kaiser, City News.
Hey, good afternoon. Thanks for taking my question. Not really sure whether Dr. Hinshaw could answer this or the Premier, but wondering if you have someone who refused to get the vaccine, who meets the criteria to get the Paxlovid pill, versus someone else who could benefit from it, who has gotten their shot, assuming they both have similar risk statuses and are in similar age groups, which one of those two people would be prioritized in Alberta?
Well, Dr. Hinshaw, that's a medical question, so over to you.
The current eligibility criteria include all those who are either immunized or unimmunized, who have a significant immune compromising condition, such as somebody who's under treatment for cancer, someone who's taking medication for an autoimmune condition that's suppressing their immune system. It also includes those who don't have the protection of vaccines, who have other conditions such as diabetes, for example. What the protocol is that as individuals become identified as having COVID-19, they're referred through the system to determine if they meet the eligibility criteria. They then have a conversation with a clinician who can determine, based on that particular individual's needs and clinical conditions and their context, which of the two treatment options. So we do have Paxlovid. We also have sotrovimab, the monoclonal antibody treatment that we've had available for several months. And which of those two treatments would be recommended for that individual. There is at this time, of course, a limited supply, but as people become eligible, they will be offered that treatment. And if they fall into any of those eligibility criteria, that treatment will be offered as long as it is available, and hopefully we will be able to access more supply in the coming weeks and months. What we do know, again, is that we have both sotrovimab and Paxlovid. And so far, in terms of the demand for sotrovimab, we have had sufficient to meet the demand for people who qualify. So it would be my hope that that same would be true now that we have this additional medication to add to that suite of options for early treatment. But I would, of course, always encourage those who have not yet received the benefit that vaccines provide to take advantage of that, because that is the best and safest way of protecting yourself from severe outcomes of COVID.
Okay, and Safe, do you have a follow-up today?
No, I'll let another journalist ask a question.
Okay, thanks very much. Operator, can you please connect our last call of the day?
Thank you. One moment. Chris F., CTV Calgary.
Hi, thank you. Premier, I'm just curious. I talked to a few community associations and rinks today who said that they're spending $5, $6, $7 grand a month on people whose job is just to check passports, and that grant, that REP grant of $2,000, ran out a long time ago. Do you anticipate more grants going towards them or any other small businesses since this program is still going?
We'll take a look at that, but I hope that won't be necessary in the foreseeable future. As I said earlier, I very much hope that we can wind up the restriction exemption program in the foreseeable future. We just need to start to see a sustained decline in hospitalizations. We'll keep our eye on that and the data. We won't act until it's safe to do so. But I would just ask them and the businesses who have to do this. Let me just say thank you to all of them, businesses and nonprofits alike, community organizations. I know it's been a It's been a pain, it's been a hassle, but they've been doing their part to help to keep the families going to their community rinks safe. And so really want to thank them for the effort and sacrifice they've made. But hopefully this will be behind us soon enough.
And Chris, do you have a follow-up to wrap things up today?
Yeah, thank you. I'm just looking for a bit of clarification here. Earlier in the news, or I thought you said that the hospitalization rates were down a bit. We've had peaks in the past few years that were higher than now, but I understand Dr. Hinshaw said the strain is quite high right now. And also, can you just clarify that? And also with all the, our death count seems to be the numbers seem so much higher now each day than they were before. Is that really indicative of a pandemic that's kind of slowing down?
Well, first of all, with respect to every death, of course, is a terrible sadness. And my condolences go out to all of those who have passed away from COVID and from all other health conditions over the past 2 years. And everybody else impacted indirectly in the healthcare system through postponements of surgeries. And all of this has been incredibly difficult and in some cases very tragic for families. We can continue to expect to see, regrettably, hospitalizations and fatalities as a result of this virus. And when you're dealing with such large numbers as we are, probably hundreds of thousands of Albertans who currently have active infections, millions of Canadians, even though the percentages of those infected who pass away from Omicron are much lower than the percentages who have died from earlier variants of COVID-19, it's still, unfortunately, going to affect some people with the most severe outcomes, both hospitalizations and fatalities. In terms of the numbers, what I'm telling you is that our total overall inpatient beds, number of inpatients, I should say, in our 100 hospital network has been fairly constant through the month of January, averaging between 5,200 and 5,300, while we have about 6,400 beds available. So system-wide, we're operating at 87% of capacity, and that is lower than is typically the case in pre-COVID years. We have seen at the peak, we've seen higher numbers. Often, overall, in the top 16 hospitals, system capacity often peaking out in the high 90s. So, look, I'm not for a moment diminishing the stress that the hospitals are under. It is real. It's added to by the complexity of caring for COVID patients with isolation protocols and additional PPE and medical protocols. I think we are seeing particular stress on certain urban emergency wards right now as well. And the biggest challenge is the exhaustion of our healthcare workforce, our frontline workers who've been through so much stress, and many of whom, I think about 5% of whom right now, at any given time, are having to stay away from work because they've tested positive. So all of these things combined are adding up to very significant stress. My point is that, fortunately, overall, we are seeing the system coping, and we're starting to see, I believe, at least a stabilization, if not a decline, in intensive care numbers. And that's really, in earlier waves, our greatest anxiety was around the scarcity of intensive care beds and the pressure on those wards because, for obvious reasons. And thankfully, we are not experiencing that, at least so far in the Omicron wave.
All right, thanks, folks. That's wrapping things up for today.
Thank you.